How to shoot up estrogen when you're traveling. First, you want to keep your estrogen in a cool place. I keep mine in this like Tupperware box thing inside a Ziploc with desiccants. Those are things that keep it dry. The fluid, if it's been in like a fridge or a cooler or something, it's going to be cold. You're going to want to warm it up like in your hand or something. And we're going to be injecting into our thigh. So pull your pants down, motherfucker. You're gonna need a needle with a point. You need at least one. 2 is ideal, but you can do 1. You're gonna need some alcohol prep wipes and a little Band-Aid. Band-Aid is not required, it's just a good idea. So once our alcohol is all warmed up, we're gonna take, not our alcohol, once our estrogen is all warmed up, we're gonna take our alcohol prep wipe. We're going to wipe the top of this so it's nice and clean so we don't get any bacteria in the estrogen solution. That's really important. If that happens, it can like crystallize and then you lose the whole vial, and that sucks. I usually wipe the top, and then if the thing is still wet, I'll wipe the injection site. It's about top of the thigh right here. So then we're going to open our needle. I'm going to draw back the amount I'm injecting, which for me is 0.3 milliliters. This is a 1 milliliter syringe. Most of the time when you get them, they'll be 3 milliliters. I prefer the 1 milliliters because they're easier to see the small amounts I'm injecting, but 3 milliliters is fine. So you're going to pull back so there's an air gap, the amount that you're injecting, and you're going to kind of hold it like a TV movie thing. You're steadying it with one hand. You poke it through the little rubber thingy, and then you're gonna put the oxygen into the syringe. This creates like a vacuum, and then you're gonna draw back. Depending on the gauge of the needle, it might take a minute to actually get the fluid into the syringe. That's fine, just be patient. Patient. Slowly drips in, dripping in, dripping in, dripping in. Just like that, slowly, slowly. When you got enough, you can pull it out. I draw it back more. I put too much in here, but whatever. And what you want to do so you don't waste any, you want to have a little bit of air here at the top of the syringe. You see, here's the solution, here's the air. And then we're going to turn it upside down. Tap it a few times so that the air that was at the bottom goes to the top, so we have like an air bubble at the top. We're doing an intramuscular, not an intravenous injection. Intravenous is different, and you would not do this if it was intravenous. Push it down until there's a little bubble at the top. Then I'm going to use the Z-track, or I'm going to put my hand here and pull. I'm going to take it, one motion, and then I'm going to push back on the syringe, on the plunger, and if no blood goes into the syringe, start pushing. If blood goes into the syringe, you need to pull it out and try again. Blood in the syringe means you've hit a vein or an artery, and we're attempting to inject into muscle, so no blood should come into the syringe. Out. And then we're going to put on the Band-Aid. Now what we need to do to make sure that our estrogen bottle stays clean again, gonna take another alcohol prep wipe, clean the fuck out of the top of it, really mosh it on there. Want to make sure no bacteria gets inside our vial, so it's good for our next shot. Probably have one more injection out of this vial. It's much better to keep the estrogen cool than it is to have it hot, but you do not want to freeze it. A little bit of stinging is normal. Pulling up on the syringe when it's already in is called aspirating. It's very important. You do not want to skip it. If you skip it or you accidentally inject into a vein or an artery, the medication won't be absorbed correctly and could cause some issues due to how thick the actual estrogen is. Another important step after you're done injecting is to safely dispose of your needles in a sharps container like this. They say not to replace the shield. I always do. Fucking rules. Needle in a sharps container. I throw out the barrel separately because I don't have a lot of space. You can also use a Gatorade bottle. Any kind of thick plastic wall will work. You don't need to actually buy a sharps container. I've used a mason jar too. If you're a fan of staring at needles and shit, I think the mason jar looks kind of cool. Yeah, and that's what you do. There might be some soreness for a little bit. That's fine. There might be a little bleeding at the spot. That's normal. But that's how you do it.